All right, welcome everyone to the Harris County Health and Relationship Study using research practice partnerships to assess the impact of COVID-19 on domestic violence survivors. We are so happy to have you joining us today, and we're so happy to welcome today's presenters. We have with us Barbie Brashear. She's the Executive Director of the Harris County Domestic Violence Coordinating Council, and she has worked in the domestic and sexual violence field for 26 years. She also serves as an adjunct faculty at the University of Houston's Graduate College of Social Work. We also are pleased to have Abir Monem. She's worked for more than 25 years with survivors of intimate partner and family violence, and she serves as the Director of Housing and Special Initiatives for the Harris County Domestic Violence Coordinating Council. And with them is Leila Wood. She is an assistant professor and director of evaluation at the Center for Violence Prevention in the Department of Obstetrics and Gynecology at the University of Texas's Medical Branch. She has done a lot of research focused on community-based intimate partner violence and sexual assault intervention and prevention work. That's a mouthful, but it's also a lot of work to accomplish. And we're really happy to be able to lift up this researcher practitioner partnership and all the great work and findings that they have to share with you today. So with that, I'm going to ask Jason to advance the slide and turn things over to Leila Wood.
Good afternoon. Welcome to the webinar, and we're really excited to talk today about the Harris County Health and Relationships Study. I'm Leila Wood. I'm at the Center for Violence Prevention at the University of Texas Medical Branch, where we focus on primary, secondary, and tertiary forms of violence prevention, research evaluation, and training. I'm going to pass it over to my colleagues, and we'll start with Abir Monem to introduce themselves, and then we'll get started with today's presentation.
Hi, everybody. My name's Abir Monem, and again, I'm at the Harris County Domestic Violence Coordinating Council. I'm also a data geek, so I'm super stoked about doing evaluations on programs. I came from, my start in this work was as a research assistant intern out of the University of Houston, and they were doing a longitudinal study on the effects of domestic violence on children, and I just loved being a part of that. And I love incorporating research into programming just to make sure we're on the right track and confirm a lot of the things that we are seeing. So thank you so much for coming.
Hi, good afternoon, and I'm Barbie Brashear. I'm the Executive Director of the Domestic Violence Coordinating Council here in Harris County. Just want to tell you a little bit about who the Coordinating Council is and what we do, just as some background. The Coordinating Council serves as a macro systems level organization working with organizations, agencies that have a touch to survivors and victims and working to improve the systemic responses. So, you know, we think of our partners as the general community, but more specifically, the systems such as law enforcement, criminal justice, service provision, social services, healthcare providers. And we have been working in this space since 1997 informally, with formally developing an organization with paid staff starting in 2010. We have conducted safety assessments and safety audits of some of our systemic responses and have worked to really improve how those systems engage with survivors, but also serve survivors, trying to shift that onus and responsibility to our systems and to our community rather than victims and survivors to carry the burden of navigation through all of those complexities. If you want to take us to the next slide, that would be great. You can see just who our project partners were. We are so thankful to have worked pretty closely very early during the pandemic with our city and county leaders. And in Harris County, we have a commissioner's court of elected officials that set the budget and lead the county works for our community. And we approached them pretty early, thinking about what are going to be the needs of survivors. And we all know, we heard really early that survivors were being extremely negatively impacted by COVID and stay-at-home orders. And we wanted to try to get ahead of that as much as we could. We started meeting with law enforcement and the district attorney's office and the judge's office. And so we were kind of prepared when funding came in from the COVID relief packages to position ourselves to get some of those funds. And we earmarked much of that money for direct financial flexible assistance to survivors. But Abir and I talked very quickly about, we need to take advantage of this opportunity with some of these funds to really learn what's happening. And Abir said, well, I know the perfect person to help us, Dr. Wood, let's reach out. So she did, and that's how this began. And the three of us had some really fun meetings thinking about what we could ask and how we could develop this. And the county jumped on board and said, yes, let's do this. This is an opportunity to be proactive. How do we use research and evaluation and data to inform planning for the future needs? So that's how we got here. If you want to advance to the next slide, that would be great. And so you can see that these were the project goals, and this came from the three of us really thinking, using Dr. Wood's big brain and Abir, her love of data. Let's think about what might be. Let's ask it. So that's where we started. That's why we're here, and we hoped. Well, we know that we would be able to use this information to inform interventions and right-sizing systems moving forward. So we're really thankful. And I'll pass it to Dr. Wood.
Okay, if you could advance to the next slide, please. So when we kind of envisioned what the project would look like, we really wanted to understand about the experiences of people who had been impacted by domestic violence. So we designed a survey with follow-up interviews that we were able to collaborate with community partners on to look at the experiences of Harris County residents, 18 and older, who had been impacted by domestic violence in the past year. So we were looking at the majority of our sample, the vast majority of our sample were survivors of DV. We did do some targeted recruitment that we'll talk about later, and kind of our lessons learned with programs that work with people using violence. But we started out with kind of broad eligibility questions, and then we're able to use the behaviorally specific screener questions to get to our target group. Next slide, please. So what we planned was a quantitative to qualitative design where we collaborated as a group, and then we also collaborated with these 20+ community organizations that are in the Coordinating Council's network, which I just can't emphasize enough what an incredible asset and collaboration that was. So there was the collaboration between CVP and the Coordinating Council, but then there was also just the collaboration that the Coordinating Council has going on that we were able to tap into. So this was really a from the ground up design. And what we did was we developed a comprehensive web-based survey that we feel.
Yeah. I'm sorry to jump in, Leela. We are having some trouble with the slides right now. So for many people, they're cut off. So
Okay.
Our webmaster is going to take just a moment and fix that, and then we'll get going again. Oh, now
Okay.
look at that. Okay.
Okay, perfect. And then based from people who responded to that survey, and I'll talk a little bit about how we got that out there, we did follow-up interviews with survey participants just because we know we can learn a lot more in-depth experiential information on interviews. Next slide, please. And we're happy to send interview protocols to folks, or if you want more information about the measures or any of the methods. We're going to focus on the results today, but I'm happy to talk with anybody about that. We took a lot of safety precautions with the study because of the context of COVID and stay-at-home orders and people possibly being isolated with their partner using violence. We took a lot of precautions to not only make sure that the survey was more safely accessed by survivors, but that people were able to engage with the questions at their own time and their own pace. We also had an incentive for participation. We had a $50 gift card for the survey and a $50 gift card for the interview. And I just want to say that that amount really came from our conversations with the coordinating council about what might work, and was really one of the most innovative parts of, sometimes when we do the survey research, we really try to lowball the incentives. And that $50 amount was really a sweet spot for honoring survivors' time at this very difficult time to conduct a long survey, 45 minutes, but also, avoided being coercive in any way. So it was really a great idea for us to think about incentives in a broader sense of missed childcare, transportation, and increase that amount. Next slide, please. Okay, so we had 20 different agency partners that we worked with to get this out, and they weren't all domestic violence agencies. Only about half of them were. So we had survey recruitment materials that went out to all the DV orgs in Harris County, but some other organizations too. And Barbie, could you just talk a little bit about how, because you all kind of cultivated these relationships and picked these spots. How did you find these organizations? How did you select the ones that we would work with to get the survey out?
Great question. Many of them are part of our just MailChimp list, our listserv, wanting to come to meetings and trainings. We also have a monthly meeting that has been a standing meeting for almost 18 years. So we have this really broad network and rich diversity of who comes to those. So it's not just the standard folks that are working as advocates in the field. It's so much broader than that. And we have such a good following. It's kind of a cult following. And we were able to send out an email, and it was kind of like, this is that old Fabergé, I'll tell one person and they'll tell one person, and so on and so on. That it really just, that's how it happened. I think it's because we have great relationships and have been doing the work for a long time.
And aside from the DV organization, so there's several shelters, non-residential centers in Harris County, because it's a huge county, it's a diverse county, big population. What were some of the other types of agencies that you chose to target for this survey distribution? Because you and Abir told me that first meeting, we want to make sure we get outside of traditional DV services.
Yes. So we have some grassroots organizations that are working in specific population and ethnicity and race specific communities that are, Pure Justice is an advocacy group that's working in the African American community on criminal justice reform kinds of issues, voter rights issues. We have Moms Demand Action that's working more broadly with gun control issues. We have several really small, again, very grassroots, African-American led organizations that are doing outreach in specific targeted communities. We worked with our probation office and said, hey, can you send this out? And they did, they loved it. We worked with the district attorney's office, who has a strong presence in filing protective orders on behalf of survivors, and they sent it out. And then we have our family violence investigators with law enforcement that have their own little networks, and they sent it out. So those are some of the organizations. In healthcare, we had some healthcare providers that sent it out.
And one thing that was really cool, I thought, was that you all very intentionally worked with some of the basic assistance agencies that were seeing a huge volume of clients for food service and rental vouchers. And they, we had electronic and print materials, and they pushed it out, so we were getting people coming into food pantry that could take the survey, and, people got through the screener questions and they were invited to take the whole survey. But it was, I thought that one of the things that was so rewarding for me was the way that you all had kind of built this community, and then in that community of, because they had such trust in you, they opened their arms up to the research. One thing that we did that I'll just, as we go to the next slide, that I'll mention is that we did little web conferences and Zoom meetings with any organization that wanted to talk about the study before it launched. We would meet with them in group formats with several organizations at the same time, or we would schedule something that worked for them so that everybody was fully briefed about the study. This took more time, but it was really essential to building that trust. And so everybody understood, because advocates had a lot of great questions about survivor protections, incentives. What about Spanish-speaking survivors? We had such great questions on those. So if you have the time to do a lot of different orientation calls, or even just a few, it's really critical to relationship building. Okay, we'll jump into the findings. I'm going to just start by some demographics. If we go to the next slide. Okay, so we had 446 survey participants, and the majority of them were female identified. We had a really racially and ethnically diverse sample that really mirrors the diversity of Harris County, where the study was fielded. Next slide, please. We had a really nice distribution in age. You'll see notably that we have about 30% of participants that are in that emerging adulthood period of time, which we know is a really high risk time for violence victimization and perpetration. So I'm really happy to be able to hear from those folks. And so we're able to have a significant range of age and experience throughout the survey. Next slide, please. So we had a lot of participants. We had 61 participants that had children. I do want to note that we're going to be talking a lot about economic impacts of COVID with survivors. And we'll get to this later, but about 80% of the sample were folks who had had past year DV victimization experience, either physical, sexual DV victimization experience. So we're really talking about DV survivors here. Only 30% of our sample of 446 people that needed childcare had access to it regularly at the time the survey was fielded in December. This was a huge issue for these families, and this is the first kind of indicator you're going to see as we go through about the economic impacts. But one of the notable things right away is that folks did not have access to childcare, and that was a big need for these families. Next slide, please. Okay, so we recruited 446 people for surveys, and we did that in 5 weeks. And if you do survey research and you've done it during COVID, you can understand how incredible that network was of agencies that we were able to pull that off. We interviewed 48 people that had participated in the surveys with our staff at CVP, who are all trained in trauma-informed interviewing techniques and worked with survivors in the past. And we really wanted with those interviews to understand people's experiences in domestic violence services and experiences outside of domestic violence services. So we had about half and half. I will say that our sample overall, about 50% of them were recruited from domestic violence services. 25% of them were recruited from social media and word of mouth. And the other 25 about were recruited from other social service agencies. So I'm going to pass it on to Abir to get into a little bit more of the data. And I think we can go to the next slide.
Thank you. So as Dr. Wood was saying, they did the survey plus interviews. So on the interviews, the children came up as super important to the survivors as they were talking. And as you probably know, is that they were under a tremendous amount of stress. I know some of you all out there, when the kids weren't in school and everything was shut down, the parents were under lots of stress. And our survivors, so on top of fleeing or being in a domestic violence relationship, they also had those same extreme stresses. They were most worried about their children's safety and mental health. A lot of the parents observed behavioral issues, in particular depression, and some even had some suicidal ideation. I know that they've talked about this on the news for the country in general, but our survivors were also dealing with that on top of, again, the trauma from the domestic violence. The social isolation played a part in that, as well as everybody just being on edge because of the coronavirus. Obviously, again, and confirmed again, is that without childcare and in-person school, it's really hard to work. So that's the problem that our survivors had, that parents all over the country had during the pandemic as well. And then, of course, as always, partners that use violence often use the children to put more stress on the survivor, and this continued during the pandemic. Next slide, please. So this slide shows the pre and current employment status. Again, as with so many dealing with the pandemic, we had lots of job loss and income loss. Our survivors had, most of our survivors, 83% fell under the poverty line. So you're dealing with some really scarce resources. They had about half with reliable transportation, and then the other half either not reliable or sporadic. You can see that there's a drop from pre-pandemic where most people had the full-time 40-hour jobs, and it dropped down, or 54%, and it dropped down to 24% during the pandemic. So that's a pretty significant number of participants that lost income. And of course, that always adds stress to an already stressful domestic violence situation. Next slide, please. And so in terms of housing, of course, without income, then there's homelessness. And also when you have domestic violence, there's homelessness. So about 56% of our participants experienced homelessness during the COVID pandemic. The breakdown here shows their housing situation when they took the survey. But 56% is a really high number of participants that experience homelessness. Next slide, please. Okay, so in terms of the pandemic and working in housing, job loss, again, anytime you lose income, as we know, it's going to cause a whole host of problems. The other thing that was happening, again, just like most of the country, essential workers that kept working without protections were really scared. Everybody was on so much edge. There was so much fear in the pandemic in terms of exposure and that sort of thing. So many of the survivors that were essential workers had that fear on top of the fear that was already present due to leaving the violent relationship or still being in it. Also, partners that lost the job, that increased the intensity of the domestic violence. And that's actually one of the top lethality risk factors, unemployment of the partner that uses violence. So this was like a perfect storm of horrible for the survivors, and it showed in the research. The other thing that was noteworthy is that the domestic violence prevented workforce reentry. Lots of people were trapped hostage in the house with a partner that used violence. Lots of jobs shut down, and the jobs that were available were remote work, and so you were still in the same locale as your partner that used violence. There was no escaping. And so the homelessness was due largely to fleeing the domestic violence and job loss. Next slide, please. So I want to shift a little bit to health, because these data is really concerning. The next few slides are really concerning about the health and well-being of survivors. So pre-pandemic is the gray bar, and you'll see that there was a 80% that reported excellent, very good, or good health, and then that decreased at the current time that they took the survey. And again, Dr. Wood was saying there's about 69% of the participants that were 35 and under, so it's a pretty youthful population. So you wouldn't expect there to be lots of health problems with this population. But you can see that, again, during the pandemic, there was a pretty significant decrease in folks that reported good health and a pretty significant increase in folks that reported fair or poor health. On the right side of the slide, this is the breakdown on during COVID, there was an increase in the following things, and most noteworthy in my mind is sleep problems, because if you can't sleep, that causes a whole host of other really debilitating symptoms. Mental health, which is one of them. Mental health symptoms increased by 73%. That is just gigantic increase. Loneliness, obviously, that is one of the components of perhaps depression, that sort of thing. Difficulty accessing mental health treatment. So you're seeing these increases in mental health symptoms, but difficulty accessing mental health treatment. So you're just kind of stuck yet again, almost held hostage. And then also significantly is drug and alcohol use went up for about 26% of the participants. That's a pretty significant amount. So that's really noteworthy. We had 9% of the participants tested positive for COVID, but I'm sure 100% were fearful of being exposed to COVID. 54% reported relationships being more difficult since the pandemic started, which, again, due to all these things that we're discussing, that makes complete sense. Next slide, please. Okay, so this slide is actually my passion. For the last 15 years, I have been doing research and different programming for survivors who potentially have traumatic brain injury due to blunt force head trauma, strangulation, or violent shaking. And our survey, there was a HELP screen, which is a screening that non-clinicians can administer to see if there's a potential for traumatic brain injury. You'd have to then do like a brain map and a neuropsych and that sort of thing to confirm. But these screens are actually a really good guide to see if there's a potential for brain injury. So almost 41% screened positive for potential traumatic brain injury. That makes all the difference in the world in terms of how you serve this person and their possible outcomes, how much support they'll need in order to achieve some positive outcomes. So this is a really important measure. And I want to sort of break down just a little bit further, if I can, on this slide. So about 78% of the head trauma came from IPV, a former or current partner, and about 8% from a family member. So intimate partner and family violence were the vast majority of the head trauma. The other thing that I wanted to note is that about 53% of our participants had been strangled. And that's a really large number that I wanted to highlight as well. 25% did go to the emergency room to be seen due to this head injury, and 27% lost consciousness because of the head injury caused by their most likely former or current intimate partner. And that's a really disturbing number. There were also significant problems after their head injuries, like headaches, dizziness, anxiety. About 75% reported after the head injury anxiety. Depression, about 70% reported. And that depression is highly correlated with head trauma. So if you're in your practice, I know there was lots of advocates that registered for this webinar. Keep this in your awareness because it's really important, again, on how you serve. About half reported difficulty concentrating and remembering, which obviously is super important when you're putting together a service plan and trying to actually execute it. There was a significant people that reported difficulty performing a job or school, about almost 40%, and difficulty reading and writing and calculating, about a third. So these are really big executive functioning type things that were impacted negatively by the head trauma. There were 60% that showed changes in their behavior or attitude after the head trauma, and they had changes in their relationship as well. So I just really wanted to talk just a little bit about that, because I think it's just really important to note that this is a really big number, and it's going to have real implications on how we serve and what we do as a community. Next slide, please. Okay, so the ACEs score. This is another very disturbing bit of information that we collected from the survivors. And I don't know if you're all familiar with the ACEs. It's the Adverse Childhood Experiences score. And they were asked about these adverse childhood experiences, and the average number of adverse childhood experiences that were selected was 6.6, which is awful in terms of what the ACEs predicts is future health outcomes. So when you have a 6, you're talking about losing 20 years off of your lifespan. That's how significant it is. It said almost 70% endorsed 4. And when you have 4 or more ACEs, you have the chances of developing COPD. It increases like 390%. Alcoholism, the increase is 240%. Depression increases 460%. Attempted suicide, 1,220%. So these childhood traumas, basically, are really detrimental to adult health as you go. So health outcomes really need to be looked at carefully in your community when you're talking about the survivors that you're serving. And of course, COVID, I'm sure, made these, the health, like we discussed earlier, worse, but this is from childhood. So we're talking about some pretty serious health outcomes. Next slide, please. So again, the pandemic had significant negative physical and mental health impacts, and social isolation made the mental health concerns much worse, and including the drug and alcohol use, which again increased for a significant number of the participants, which again, coupled with the ramifications and repercussions of traumatic brain injury, it just makes brain functioning even worse. Next slide. Oh, and depression and anxiety were reported as the top health impacts. Next slide, please. Okay. So here is the summary of the mental health. Almost 64% screened positive for probable post-traumatic stress disorder, which is a gigantic number. Oftentimes, post-traumatic stress and traumatic brain injury co-occur, which is confounds what treatment that you could possibly use, which there isn't a lot out there, but whatever there is, sometimes, for example, if you do talk therapy, then that exasperates one of them, which will help with the other. So it really makes it complicated when you're looking at this full picture. And 21.5% had suicidal thoughts in the past 6 months. Depression was a very big concern, again, where we saw a very large number for probable moderate to severe depression, about almost 52%. So that's a really large number, and that was really concerning. Next slide, please. And again, the drinking was assessed, and again, they use validated measures and behavior-specific questions to get some of this information. They didn't just necessarily ask straight out, and almost 36% were at risk for hazardous drinking. And of course, again, alcohol, brain injury, post-traumatic stress, you're looking at just a conundrum of horrible components to the survivors' existence at the time. And I'd like to do a polling question, if we could, really quickly, and then I have one slide left after that, and I'll turn it over. So if we could do the polling question, please, on There you go. If everybody could just take a minute, and what was the main impact of COVID-19 on the mental health of the survivors in your community? Was it depression? Was it anxiety? Was it increased post-traumatic stress or other trauma symptoms? Was it isolation? If you just take a minute and answer that, we'd love to know what your information from your community was, and we'd love to compare it. And I don't know if we mentioned, but Harris County is the county that has the city of Houston in it. And so most people don't around the country don't necessarily know Harris County, but that's where the city of Houston is. Okay. So we'll just give a couple of more minutes or seconds for everybody to put in what they think was the main impact of COVID on the mental health of their survivors. And if we could go to the next, so there we go. So depression was 15%, anxiety 26%, increased post-traumatic stress at 11%, and isolation. This is really big because that's really a huge component, right, of the dynamics of domestic violence is isolation, and it looks like it just got worse in everybody's community, and that was confirmed. So thank you so much for participating in the poll question. And if I can have the next slide, please. So we talked about mental health being a big, mental health symptoms increasing in a big way during the pandemic. And we asked on the participants, what were the barriers that you had in seeking help for these mental health? So almost 69% did not see a mental health professional. And 20% tried to use it, but because of the pandemic, it was unavailable. And so we asked why. And so it looks like of the sample, 11% said they couldn't afford it, 6% couldn't get an appointment, a very small percent did not have language services available. Almost 3% couldn't use virtual services. We see that a lot when survivors don't have access to Wi-Fi or phones and that sort of thing. Afraid of COVID, and then either being on a wait list or another reason why they did not seek mental health professional counseling when they had such a significant increase in mental health symptoms. So I'm going to go ahead and pass it to Leela so she can the next few slides.
Okay, we can go to the next slide. I'm going to talk through some of the domestic violence related data that we collected. So as I referenced previously, 82% of the sample had some lifetime experience of sexual assault, physical or sexual domestic violence, and 70% had one of those experiences in the past 12 months. The remaining percent are majority people who had psychological or economic abuse in the last 12 months, and a small percentage of that is folks who had used violence in the past 12 months. Just so you have a sense of the folks that we sampled in their domestic violence experiences. So if we go to the next slide, we can dig into that a little bit more. So this is looking at domestic violence victimization in the last 12 months. And again, we used, not only did we use that behaviorally specific screener to make sure we were surveying the folks impacted by DV that we wanted to, we also used a behaviorally specific screener. We used a modified version of the conflict tactics scale 2, the revised edition, and we added questions about reproductive coercion, forced labor, and coercive control, and economic abuse. So as you can see, in the last 12 months, a large portion of our 446 participants, nearly 70%, had experienced physical violence. For the majority of our sample, they had experienced more than one type of domestic violence. So, nearly 50% had experienced at least 3 of these types of domestic violence. So we're talking about a lot of polyvictimization across domestic violence types. Next slide, please. One of the really interesting questions, of course, has been about frequency and severity of domestic violence during COVID. And so we asked several questions to touch on that. I do want to just point out here that of people who had experienced physical domestic violence victimization in the last 12 months, the average or the mean amount of different physical violence incidents was 16.37. That is a lot of physical violence. If you look down at sexual violence, the average amount of incidents of sexual violence was almost 6 in the last 12 months. So we're talking about lots of different violence, high levels of violence, and a polyvictimization spectrum. Next slide, please. We also saw a lot of significant risk factors, things that we know that are associated with increased risk for danger or lethality. You know, we had nearly 12% that had been threatened with a gun since the Texas lockdown started on March 13th, 2020. So that's really concerning because we know threats with guns and weapons is one of the highest lethality indicators. And then we had a quarter of our sample that had ever been threatened by the partner with a gun. So we had some significant lethality factors here that we really, thought was important to look at. Next slide, please. Okay, so, one of the big questions has been, did domestic violence increase during COVID? And the survivors we sampled said, yes, it did. So 51% said the violence increased since the COVID lockdown started. And then another 6.5% said it didn't even start until the lockdown started. So, one thing that I just want to point out is our sample is not only is it racially and ethnically diverse, but we had about 20% of our sample who identified as LGBTQ+. So we have different constellations of partners and relationships in here that as we continue to do more analysis with this data, we will look at some of those, but just really, from what we can see, not only from the survey data, but from the interview data that we did, is that absolutely violence increased, and that, things like partner losing their job, losing housing, lack of funds in the household, these were all things that contributed to increased risk for violence.
Can I toss something in with that real quick?
Absolutely.
Just want to add what we heard from our law enforcement partners were that felony level assaults rose by over 50% during the year 2020, during COVID. So from the end of March through the end of 2020, December 2020, felony assaults were up over 50%.
Yeah, that's just, it's just really concerning. Sorry, this is some bummer data, but we're going to get to some good stuff here in a minute. Next slide, please. Okay, so one of the things I just wanted to say is that for many people, the impact of COVID was increased abuse. The other trend that we saw really strongly was violence increased, and then the person had to exit the relationship to preserve their life or to improve their child's safety. So we saw that trajectory in the interviews again and again and again in the open-ended questions of the survey, that a really steep escalation and then like a critical need to leave. So this may be part of the trend we see across the country with service numbers being either down or stagnant, but the severity of these cases coming through the door at shelter or for law enforcement for those increased felonies are really increased because people are waiting to a breaking point, basically, to leave those violent relationships. Next slide, please. Okay, so one of the things that I wanted to talk about briefly is when we first talked about this study, Abir said, I want to look at safety, but not the way everybody looks at safety all the time. She said it much more eloquently. But Abir, could you just talk a little bit about your vision when you said, let's do something a little bit different at looking at safety planning and safety strategies?
Sure. Yes, this is another thing that, Barbie and I have had conversations about where does safety planning information, what informs the safety planning that we've traditionally done as advocates since at the beginning of the movement. And are our safety strategies all centered around the survivor leaving? And then you have this pandemic where the survivor can't leave. So this would be the perfect time to get some little nuanced and detailed information about safety strategies. And what we did was we've been looking at some work by Jill Davies. I'm sure you've all, the advocates, have heard of Jill Davies. And she did a white paper, and it was called Victim-Defined Advocacy Beyond Leaving. Safer through strategies to reduce violent behavior, right? And I also pulled my team of case managers we have several different housing programs. And I asked them, what were their survivors reporting that they were doing to stay safe, both in the relationship and then once they fled. So we compiled a list of safety strategies to include in the survey, and we got some great information. I'll send it back to Dr. Wood.
So we basically looked at all the existing safety measures, and then Barbie and Abir led their team and review of different strategies in addition, and we ended up with 15. You see, and if you want to see the whole list, please let us know. It's also in the report. These are the top 3 and the bottom 3. You'll notice that the top 3 are really informal strategies that don't rely on formal support networks. That's what survivors tend to use first. Survivors also tend to use more than one strategy. We asked about the amount of strategies folks were using. And let me just say, these were strategies people had used since that lockdown started, so since COVID had started. So it may be pre-COVID, different strategies were used. But we know that 66% of those 400 plus respondents used at least 2 or more strategies, and 57% used at least 3 or more strategies. And from our interviews, what we know is people are using strategies based on danger assessments that they're doing themselves and the partner's behavior and their needs at the time. So, really looking at safety strategies allowed us to understand how survivors are getting through this pandemic and what strategies and networks they're using. And those friends and family networks become really important to getting through that hard time. Next slide, please. We also asked about sexual assault using behaviorally specific questions adapted from the Sexual Experiences Survey. So this was sexual assault. We asked about domestic violence related, sexual domestic violence, but we also asked about sexual assault outside of the context of an intimate relationship. And what we found is that in the past 12 months, 16% of our sample had experienced a sexual assault, had experienced a rape, some kind of penetration. This is a really high number. So CDC's population estimate is for American women over a past 12-month period of time is around 1%. So just to give you a sense of 16% is really high. I will have you note that for many of the people we surveyed, that sexual assault experience was from a current or former partner or a friend or acquaintance. So it's still very much what we know about sexual assault being really in the realm of someone you know. So again, thinking about those health and wellness outcomes and some of the service access related to COVID, not only do we have these high levels of domestic violence, but we have really high levels of sexual assault in the sample. Next slide, please. We also looked at the differential impacts of COVID-19 by the different, racial and ethnic groups that we had in the sample, especially just looking at the diversity of Harris County. And what we saw mirrors all of the data that we have seen about COVID thus far, is that particularly Black participants in our sample were disproportionately affected by economic job loss, and so were our Hispanic participants. But Black participants in our sample had higher rates of physical and sexual domestic violence, and Hispanic and Black participants had higher rates of reproductive coercion. So I just want to kind of highlight that one thing that we saw really clearly was these health disparities caused by racism were really clearly coming out for our domestic violence survivors as well, in the economic outcomes and in the level of violence that they were experiencing. Next slide, please. So we asked about what kinds of help people were seeking during this time, if they had sought help. And what we saw pretty strongly is that people go to friends and family first, and then they go to basic needs assistance. So you can see food, rental assistance, and then church assistance, of course, being part of that basic need panorama. So one thing that we saw is that, there was more difficulty trying to access rental and housing services, though those were top needs. And that was something we saw throughout. We had that very high rate of homelessness during COVID, that housing assistance was one of the most critical needs. Next slide, please. One thing that we observed is that, for many people, lack of access to services was really difficult. Some of the food pantries didn't have food for specialty diets. Wait lists, even if you were like really tech savvy, wait lists were really difficult to access. Some of the technology didn't make sense. I mean, if you can just think about the vaccine rollout in some communities and trying to get on a list, that was what it was like to try to get a food pantry or try to get services. There was really things that were supposedly low barrier were actually pretty high barrier. The other thing, and this is one of the most critical takeaways of our study, is that stimulus checks and cash assistance were literally life-saving for our participants. We saw again and again on surveys and interviews the importance of stimulus checks. Harris County did their own county level stimulus, and some of our participants got that stimulus, and it allowed them to leave violent relationships. It allowed them to pay off credit debt that allowed them to get the house to leave. We also had, about half of those participants coming from DV services that were benefiting from some of the cash assistance that the coordinating council was running. That cash assistance was instrumental in how people got out of violent situations and how they got their kids to safety and stabilize their families. So one thing that was really clear from what we're seeing across all these different data that we have collected is that cash assistance and stimulus funds and rental assistance are literally life-saving for domestic violence survivors, especially during COVID with all the economic impacts. And I think we have a polling question next. Okay, so for survivors in your community, which of these economic programs was most helpful during COVID-19? And I know it's hard to pick. Housing vouchers, stimulus checks, childcare vouchers, and we also just gave you the option of all of them. So we really found that these economic programs were really essential to helping survivors out during this time. I'll just give everybody a minute. Okay, are we ready to show the response? Stimulus checks, okay, and all of them, okay, yeah. So that just kind of goes to the power of cash assistance and how important that is. And if we think about things like the child benefit and some of the other financial contributions that might be available for survivors, and as you're advocating for different funding in your community, looking at cash assistance is a really powerful tool to helping survivors. Next slide, please. So I know we're running short of time, so I kind of want to, some of the information that we have about the criminal justice system merits, more time and consideration, but I just, wanted to briefly say that we asked people if they had reached out to law enforcement because of situations in their relationship, and really for folks that didn't reach out to law enforcement, the majority was because they didn't perceive that they needed it. And we definitely saw there were some differences in by racial and ethnic groups in terms of perceptions of law enforcement, with Black and Hispanic participants more likely to endorse that they'd had a bad experience with law enforcement, they were afraid of law enforcement, or had heard negative things about them. So again, as we think about centering racial justice in some of our domestic violence work, we really are thinking about when we not only do survivors not use law enforcement for safety as much, there may be really compelling safety reasons that they don't based on past experiences. So as advocates, when we're thinking about our practices, we may need to be recommending other crisis intervention services as well as law enforcement, or partnering with law enforcement to do change work, because it may not be a viable reach out for many of the survivors we're working for. And if we can go ahead 2 slides. Okay, Barbie's going to pick this up talking a little bit about, we asked people about their experiences in DV services. We had about 30% that had used DV services and about 12% that had tried and been unable to. And if you go to the next slide, I'm going to let Barbie pick it up and close us out about people's domestic violence experiences. And I realize folks may need to go because we're hitting the hour, but if you want to hang out and answer questions or email us, we're here. So I know you may have other stuff to go to. Sorry, we just love our data and got a little excited.
And I'll just be really brief, because you can see by the numbers that when folks are connected to services, they find them really helpful. And I think that just really speaks to the breadth and the knowledge and the wisdom that survivors are able to tap into from advocates. You know, advocates do so many things and have to get really creative in our work. And I think that just really shows. And, you know, the power of relationships should never, ever be underestimated. When we take the time to validate and listen and, you know, use our non-judgmental lens, survivors know our authenticity, and they feel like they can get connected. Now in Harris County, which is Houston, we have a high turnaround rate for shelter services. So that's always been the case, as much as 70%. So getting really creative during the pandemic, as Dr. Wood showed us, like when people left, it was because it was that breaking point and it was really egregious violence. So we knew we had to create other ways to get folks to shelter. So we used a lot of the COVID relief dollars for hotel services. So we counted that as a shelter option during that year. I also can't stress enough, and this is something that Bear and I spend a lot of time on, is if you're working in an advocacy program, how important it is to provide a really strategic and intentional level of supervision and support to the staff that are supporting the clients, like creating this wraparound way to really process and staff cases, and then also support and educate and just kind of be there for those that are actually on the front lines doing the work, creating that line of supervision. Back to you, Leila.
Susan, while we kind of have the next slides in the background, do we have questions? Because I know folks need to get to their next meetings, but are there burning questions we can start to answer?
Yes, we have had a couple of questions come in. First, you did say that folks can get a copy of the protocols and questions that were used in this?
Yes, they are not in the brief report because as some of you researchers may have gotten this feedback, sometimes our idea of a brief report is way too long. But it's all available by request, and folks absolutely can reach out to any of us or email me, and I'm able to send anything that folks need.
Okay, great. Another question, do you think that COVID is increasing the ACEs for children living through this, especially if they're in families with domestic violence?
Oh, I mean, absolutely. I don't have data. So do I think from our qualitative data and just from the survey data, do I think there's I would say I think that's a very good chance, and that some research needs to be done with these kids. I'm really worried about teenagers in particular, but if we're looking at what's happening to their parents, I'm not quite sure how I could come to any other conclusion. But especially because some of the safety networks from kids, we just heard again and again about these parents who are trying so hard to help out their kids, but don't have childcare or school or other supports, and how difficult that is.
Mm-hmm.
So I would say yes.
Another question, did you see any survivors not able to get their cash assistance, either because they were in shelter or because it was taken by the perpetrator?
I don't know, Leila, if that came out in your interviews.
The second one came out in the interviews. A lot of strategizing about how to avoid the perpetrator getting the money. I did not hear the first. What about, have you all seen that in practice?
No.
Because we were giving out funds, we didn't not have them, we didn't see that other side. I think we did hear from some folks what you just described, that the cash or the check or the gift card was taken by the person who's using the violence.
Yeah, many of our survivors don't have bank accounts, so the direct deposit option was limited for survivors that we serve. So I'm sure that that's always a problem.
Jason, would you go to the next slide? So one thing I just want to mention that survivors did really like was online court. So online court got rave reviews for safety reasons and accessibility. We had really mixed experience with law enforcement in the data set, and that's something we could have a whole presentation about. But one thing that got, along with DV services, cash assistance, housing vouchers, the other thing that got rave reviews was online court.
Which also this helped informed, we have a 280th protective order court in Harris County. It's the only court that hears protective orders in our county. And when we shared this with the judge, she's like, I've already, this just helps support what I want to do. I want to keep this as a viable option and, continue to think about how we do it in safe ways and address, virtual connectivity issues for survivors and things like that. So having this opportunity to do this study really informed practices throughout the county. So,
well, that's a good segue into the next question, which is how will you use this rich data moving forward? Do you have other examples like the figuring out how to do more remote court?
Well, we do. So we dangle Dr. Wood in front of anybody who will listen to tell them this information. And I think we're going to end up wearing her out because the more she tells the information and shares the information with folks, the better the outcomes. We have had a meeting with our local county mental health and behavioral health provider, and we're strategizing new ways to connect folks and triage folks quicker into that system because of this work and this study. We are in front of county budget groups to talk about how to keep this as an ongoing assistance fund beyond COVID. Law enforcement is hearing this as well. The need to get into Black and brown communities and provide community-based services that meet them where they are is also informing the work. So I think I think the more we dig in, the more we'll learn and the more we'll continue to do.
Jason, would you mind going to the next slide? I mean, I think that for the researchers that are still in the call, this is an urgent time for us to be partnering with communities to evaluate some of this innovative stuff that's happening. And I know it's hard to find the time and the money to do it, but as these programs innovate with things like online court, with things like, cash assistance or increased housing vouchers, or even some of the economic things coming down the pike from the federal government, this is a critical time for us to get in with your existing longitudinal studies or any work that you have going to ask about if folks are getting access to these, what the impact is, or just look at it correlated with your other data. I mean, this is a critical time to be updating our measures and how we're looking at economics as new programs are being rolled out. So I would just implore all the researchers on the call to be incorporating that and reaching out to your communities, ask them what new things they're starting and how you can help evaluate those, because we have a replication crisis and we have an evidence crisis in the domestic violence research field. So anything that you can do right now to contribute to that, I think is really important.
So can you restate, how did you all get connected? Because I think that the reason that this study is so rich is because you were so collaborative on it. How did you first come to, and so how can the folks at home find their own partner like this?
Well,
Abir, you want to tell?
Well, again, I've been a data geek and data driven for a long time. And at my previous job, which I worked at the Fort Bend Women's Center for 20 something years, and also worked for the Coordinating Council. And we did some evaluation studies at Fort Bend on our housing and shelter programs, because I love evidence-based information and not just this is a beer saying it. So I'd love to collect that data. And Leela's group, she was with the Institute for Domestic and Sexual Violence with the UT Austin at that time, and also and I think we got connected through the Texas Council on Family Violence through Molly. And so we had them come to Fort Bend and do a study there. And so when it was time for us to think about doing a study here, I was like, I know exactly the person to do the study. And so we reached out to Dr. Wood to do this one as well.
And we have many more plans together.
We do. We do.
You know, we got another question in about funding and sustainability possibilities for domestic violence organizations. And I'm wondering if you can speak not only about that generally, but about how this kind of study puts you, Barbie, in a better position as the executive director to go out and advocate.
Thank you, Susan. It gives me evidence. It gives me direct evidence about need and direction. You know, you can see, you know, when Dr. Wood presented to our commissioners about flexible funding, cash assistance, and housing being life-saving, all I had to do is come behind them and say, look, national research shows us that domestic violence homicide costs a community $17.25 million. Okay. So that's one domestic violence homicide. We had this much money in flexible funding. We had $2.1 million in flexible funding that we were able to administer. We served over 2,000 families with that. And that doesn't even come close to what it costs a community when you lose someone. And that's just the financial cost of losing someone, right? So it gives me a lot of really solid data and information to support a need, a financial need.
All right, well, it looks like we have reached the end of the formal questions. So I want to thank all of you so much for sharing this with us here today. Folks at home, remember you will be receiving a survey, and we really do want you to take that survey. That's also your opportunity to request a copy of the slides. Jason, if you can advance, I'm pretty sure that we'll have an ending slide with contact information. There we go. Folks, you heard our presenters offer to answer your additional questions or queries, so feel free to reach out. And I'd like to offer each of you an opportunity for a closing thought. We'll go, let's see, alphabetically by last name. We'll start with Barbie.
My closing thought is a thank you to everyone on this call, everyone who's listening. Thank you for your hard work. It's been a hard year, right? It's been a really difficult year, and thank you for, you know, your showing up here shows how much you care about advancing and protecting and increasing access to services and really working to keep folks safer.
Abir?
For me, again, thank you for coming, and please use this information to start conversations at your agency so that you could rethink your services, the models that you're using. If it's just traditional, think about a little bit of innovation around brain injury and screening for it, and really getting to know who the survivors are that you serve, because you'll find that you'll need to make some programming adjustments, and you'll have better outcomes. So please use this data.
And Leila.
I just want to say thank you so much for hosting us. And I wanted to say, especially to the researchers and funders and other folks on the call, practitioners and those on the ground will always make your research better. There is no exception to that. And you can always, you learn way more if you stop and listen and gather feedback instead of being boxed in by convention. So I just wanted to say that for me, this was an incredible experience because not only were we able to provide data that's going directly where it needs to go, but also because we were able to partner and really improve our methodology. And it tested the way our team did things, and it made it so much better. So just always partner with practitioners. It will make your work better.
Well, thank you all. What great thoughts to close